Hi, this is the second part of my dry drowning thing. I have the introduction in the first part. I just want to say really quick, because I don't have a lot of time in these clips, that I don't think anyone is stupid for thinking anything they think. I really was totally convinced that she probably did have a concussion at one point, and then when I actually did think about it, and I mean, I really thought about it for a while, it just didn't make sense. Could something else have happened? Totally. Absolutely. But just not that. And I know a lot of people don't believe this story, but a lot of people still do believe that something happened, like she hit her head or she drowned. A lot of people believe in secondhand drowning or dry drowning, which no one has a reason to not believe it, but after I read some stuff from medical journals, I think you will feel otherwise. In 2017, a young boy was swimming in a Texas dike. About a week later, he had died. About a week of vomiting before this. The boy was in knee-level water, and it was said that he fell into it for a few seconds. Media reports, including CNN, reported that this boy died from a dry drowning. Later, an autopsy showed that this boy had an enlarged heart. Many medical journals have the story before discussing dry drowning and secondary drowning to explain how it is misinterpreted. The medical definition of drowning is the process of experiencing respiratory impairment from submersion/immersion in liquid. This would be referring to aspirating. There is a long and upstanding list of medical societies that do not consider this a term and discourage it, including American Red Cross and CDC. In fact, a dry drowning has only ever been used to describe when somebody has died in water, but there is no water found in their lungs. So everybody's saying that she could have had water in her lungs. That's not what a dry drowning is. That's actually a secondary drowning, which are often confused for each other. That's also said in this medical journal. Furthermore, it describes that most drownings actually don't have very much water in the lungs. The cause of most deaths in drowning is actually loss of oxygen. According to the Cleveland Clinic Medical Journal, secondary drowning is sometimes called delayed drowning. It is another term that is not medically accepted. The historical use of this term reflects the reality that some patients may worsen due to pulmonary edema after aspirating small amounts of water. Drowning starts with aspiration, and a few or only mild symptoms may be present as soon as the person is removed from the water. It goes on to say that either the water that is in the lungs will be absorbed and cause absolutely no complications, or rarely the conditions will become worse over the next few hours. It will not become worse over the next few days or weeks later, with no preceding symptoms. It says the lungs and heart do not fill up with water, and water does not need to be pumped out of the lungs. There has never been a case published in the medical literature of a patient who underwent clinical evaluation, was initially without symptoms, and later deteriorated and died more than 8 hours after the incident. People who have drowned and have minimal symptoms get better, usually, or worse, rare, within 4 to 8 hours. In a study of more than 41,000 lifeguard rescues, only 0.5% of symptomatic patients died. It does say that you should seek medical attention, that if within 8 hours of a drowning incident, this means that you were submerged. Okay, so an incident has to occur for this to really take place. It's not really that you're just swimming in and bam, it happens. I know that's what the medical reports were saying when the child was knocked over by a wave in Texas and then died a week later, but we know now that it was myocarditis. Sorry if I can't pronounce it. An enlarged heart. It also does say that if you have anything that seems more severe than going down the wrong pipe at dinner when you have a drink, for example, that would be the dry drowning symptoms that people are worried about, the throat spasms. If it is worse than going down the wrong pipe, go see a doctor. Otherwise, this will not happen after 8 hours later or days. This would actually mean that Hunter would have likely, if anything actually did happen following a drowning incident, like she was underwater, like Hunter says, then he would have actually witnessed that happen to her if a submersion injury occurred. And that is just considered a plain old drowning then. Because you can only drown and die, live, or have life with injuries. There's no in between. I hope this does help with Summer Wells' case. I hope this helps the true crime community get more facts about what could have happened to her, and I hope you check out these articles for yourself. They're so interesting.